Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Thank you for joining us this morning. This is the University of Kansas Cancer Center's Facebook Live, and I'm Dr. Jennifer Klemp. I'm an associate professor of medicine in the Division of Oncology and the co-leader of the Cancer Prevention and Survivorship program at the University of Kansas Cancer Center. I'm sitting in today for Dr. Roy Jensen. And my guest today is Dr. Becky Lowry, and she is the medical director for the University of Kansas Cancer Center's Transition Clinic, which is a clinic focused on adult survivors of childhood cancers. And thanks to advances in cancer treatment, there are over 400,000 childhood cancer survivors living in the United States. And while nearly 80% of pediatric cancer patients will survive into adulthood, many will have medical and psychological issues that will linger into adulthood. And again, while most survivors have healthy, happy, active lives, some may have health problems that will persist after treatment ends or may develop years after their cancer therapy. And having these individual needs assessed and receiving care in a specialized clinic, I think is really exceptional and unique to not only the region, but across the country. So Dr. Lowry, thank you again for joining us today.
Thank you for having me.
You bet. And why is it that some pediatric cancer survivors need this special type of care?
Yeah, it's a great question. I think that we find people are pretty familiar with the idea that cancer treatment can cause side effects during the time of active treatment. We find that people are less familiar with the idea that those side effects can occur years or even decades after their treatment, and we call those late effects. Late effects are really unique to each patient and their type of cancer and cancer treatment, and helping patients understand what late effects they might be at risk for and helping them navigate that process of monitoring those types of health conditions or monitoring for those types of health conditions is really what our clinic is all about.
That's great. So you literally kind of take the patient and put them into risk buckets or whatever they're at highest risk for, and that may include sort of psychological or physical effects?
Yeah, exactly right. We look at their particular cancer treatment and cancer history, and then we talk to them about the things they might be at risk for. So for some patients, that might be things like mood symptoms, like anxiety or depression. For other patients, it might be neurocognitive symptoms, difficulty with memory and concentration and focus. For other patients, it might be difficulty starting a family, so fertility concerns. And others, it might be secondary cancers or cardiac conditions, heart conditions.
So that's a lot of things sort of to put into practice. Is it important, like you used the word late effects, could happen during treatment or after? Isn't that something that as a patient maybe 5-10 years out, are they even thinking about some of those late effects, or do they even know they're at risk for some of those late effects?
Often we find that they don't know. I think that that's still an area that we're learning a lot about, and so that's what we help them understand are things that they should watch for. So an example might be cardiac late effects, for example. So if a patient had radiation, let's say, to the field that might have involved the chest, that radiation can place them at risk for difficulty with blood flow through the vessels of the heart, such as that cause a heart attack, for example, or difficulty with the valves of the heart. Also, they have might have particular types of chemotherapy in the past that impact the pump function of the heart, such that they might be prone to heart failure. So helping them navigate that and get appropriate screening for that is really important.
And I think I've seen like a curve that a adult survivor of a childhood cancer, like their risk for heart disease would start, what, 5, 10, many years possibly before an average person.
That's exactly right. We often start that screening very early. So we have patients in their 20s and 30s, say, that may be going through echocardiographic or cardiac ultrasound screening for those types of things.
And do you see from the patients in your practice, does an adult survivor even know that cardiac disease may be the biggest risk that they have going forward? They survive their cancer, yes, they're living through late effects, but really they should be worried about cardiovascular disease.
You're exactly right. I think there's a lot of lack of awareness or limited awareness about that, and it's important for people to not be dismissive of symptoms. And I think another role is ensuring that we're communicating back to the rest of their care team about those risks, because it's not typical to see a person in their 30s who has chest discomfort or difficulty breathing and be thinking that they may be at risk for having a heart attack. But if that person had chest radiation in the past, they may indeed be at risk. Absolutely.
Wow. That's a great point. And does that kind of fall into your mission? So tell us a little bit about, the mission of the Transition Clinic.
Yeah, really the Transition Clinic is such an exciting success story of collaboration in our region. We had individuals or members from the Children's Mercy Hospital, from the Midwest Cancer Alliance, from the KU Cancer Center, and from the University of Kansas Health System, all really who came together to help build this clinic. And really that kind of collaboration is so exciting, and it's such a win for our patients in our region, and it's really a privilege to be a part of that process. We opened the clinic back in 2014, and we are housed in the internal medicine office over in the medical office building. So it's an adult-based care center, and we know from talking to patients who are adults that that's important to them, to be seen somewhere where other adults are seen. And it's actually one of only a handful of clinics that are adult-based or an adult-based center for childhood cancer survivors across the country.
Wow.
Since opening in 2014, we've had a lot of growth, and that's been exciting. We also have been able to collaborate with a lot of teams here at KU, and the cardio-oncology team, the reproductive and fertility team, and so it's really such a great privilege to have an opportunity to work with a number of our experts here in our institution.
That's great. And just to follow up, I think one thing that you brought up with this amazing community and regional collaboration is how unique it is. So do most adult survivors then go to like a children's hospital? Like, where do they go? And
Yeah.
Since we have an adult clinic, which I think is so amazing for our patients and for the region, how does that work most places, and how are we different?
That's a great question. You're right. In a lot of places, when these childhood cancer survivorship clinics were first built, most of them are housed in pediatric centers. So you might be a 35 or 40-year-old patient coming for your late effects monitoring, but being seen in a pediatric center. And that's okay, but it might be less comfortable for some patients. So,
and you probably have a short little bed and colorful animals on the wall.
Yeah, the art would be fantastic. I think you're right. And so we find that we actually have a number of patients who travel into the clinic from the surrounding states and from rural Kansas as well. So many of our patients travel from western Kansas to be seen, and we really are here to help however patients and providers need. So if patients arrive to us from other providers and they have an established care team, we really encourage the continuation of that continuity, and we would see the patient once a year in a survivorship visit and help both the patient and their provider care team get a current copy of their treatment summary. So what exactly was their diagnosis? What was the stage at diagnosis? What types of chemotherapy did they receive, and at what cumulative doses? Did they receive radiation, and if so, what were the total grays or the doses of that radiation, and what regions? So they get, each patient and their providers get a copy of that treatment summary. And then we also give them something called a survivorship care plan, which really is their roadmap, if you will, to what health conditions they need to watch for down the line. And then we follow them yearly and help navigate any testing that they might need, and communicate back with their provider care team. Once in a while, we have a patient arrive to us who isn't established with any provider care team, and in that case, we can offer to see them both in primary care and survivorship.
So I want to come back to one question, but I want to make sure that we're reaching out to our Facebook Live crowd. If you're just joining us, we're having a great discussion with Dr. Becky Lowry on the importance of managing adult survivors of childhood cancers. And I believe that Alicia Miller is here in our studio, but says that we have a question from someone out in our Facebook audience. So
We
Alicia.
do. We have a couple questions here. The first is, do childhood cancer survivors need a referral to the Transition Clinic?
So that's a great question. I think that our team will help us provide the information maybe across the bottom of your screen to the link to our clinic, but there are also a couple of phone numbers, and patients can reach out to us directly without a referral. The numbers that they can find us at are either the Universal Cancer Center number of 913-588-1227, I believe, is that right?
1227.
1227, Dr. Klemp. And then our direct line to the clinic is 913-945-6655. And that would connect patients directly to our nurse navigator and nurse educator, Kyla Alsman.
Great. And did you have another question?
We do have a second question. At what age should an adult survivor start being seen in the transition clinic?
That's a fantastic question. So we usually see patients, we can really see any patient over the age of 18 in the internal medicine clinic, but really we arrive or receive patients whenever they are sent to us. So we have patients who establish with us at all different ages, but anytime after the age of 18 is really appropriate.
And so I think one question I had, and this navigation system that you have, which is very unique across the country, how does that work? And you mentioned Kyla, so you actually have a person that someone can talk to, which we know in healthcare is so nice to actually have a dedicated person. But if you are, let's say, at a children's hospital, I don't think you can stay there forever, or if you're in the community, like how do those ages really trigger how they would navigate into your clinic?
Yeah, you're exactly right. So patients typically graduate out of pediatric care sometime after the age of 18. Most of the time they cannot continue to be seen in pediatric care beyond the age of 21. So that's how that process happened. And you're exactly right. I want to touch back a bit on Kyla and her role as a nurse navigator and a nurse educator. So our nurse navigator and educator in our clinic is Kyla Ausman. She's a registered nurse. Her background is in being a floor nurse at the Children's Hospital treating patients when they were going through active cancer treatment in childhood. And since the opening of the clinic, she has been with us. She both helps patients navigate their care. So when they call, she gets them scheduled to see us in clinic. If when we see them, let's say for example, we're seeing a young woman who had a history of Hodgkin's lymphoma, and let's say that she had some radiation to her chest when she was treated a decade or two ago. She may need high-risk breast cancer screening, and so she may need to be connected to our breast oncology team down at the cancer center, and Kyla can help get her breast MRI or her breast mammogram scheduled and help her get connected with the breast oncology team. And then in addition to all of that care navigation, so really having someone at the elbow to help you coordinate your appointments and your testing and your visits together, she also does the education, which is really important. So sitting down and taking all of this literature and medical information and helping it be meaningful and useful for our patients as they come to see us in clinic. She really walks through that roadmap with them.
And that's amazing. So it's sort of, I'm envisioning sort of, you know, I'm handing the baton, but the baton goes back and forth because you have this coordinated effort. Absolutely. And I think coming to the patient where they are, which I think you described as whether the patient enters from a referral or whether they just need a good overview, having someone to navigate them through that is really important.
Absolutely,
so,
and we know that that's an anxiety-provoking time. Just at baseline, transitioning from pediatric care to adult care is anxiety-provoking for patients. Anytime for any of us, we go through a care team change. I think that that's stressful, or navigate seeing a new provider. I think that that's stressful. So really having someone who's your advocate at your elbow to help you through that process is so important.
And building on that, you kind of elaborated a little bit with primary care, but how does your clinic collaborate with an existing primary care team or a provider that a patient already sees?
Yeah, I'm glad that you asked. We really encourage the importance of that continuity and want to really fold into and help support that care however we can. We know that primary care physicians, myself being one, have a lot of competing priorities, and it can be a handful to manage all of those. And so if we can help take this piece and help the patient navigate that as well as helping the primary care providers navigate that, we really want to do that in a shared care model.
Which makes perfect sense. And I think we'll see what type of question Alyssa has for us, and maybe that will feed into that as well.
Sure. We have two more questions here. While a patient is waiting to be seen in the transition clinic, what is the best thing he or she can do to advocate for appropriate care given a history with pediatric cancer?
Yeah, great question. I think, you know, one of the best things that patients can do is to help gather any records that they might have. It may not be surprising for you to know that when we're asking for records from 20, sometimes 30, sometimes more years back, it can be a challenge, and Kyla does such an exceptional job of collecting those records so that we can put the information together for patients, but patients can really help be a part of that process by collecting any information they might have or that they might have saved from the time of their prior treatment.
And I can only imagine, you know, the records are like in some cave, you know, in a paper form, and so we're collecting records from lots of different places, and so anything a patient would have would be helpful.
Absolutely right.
Yes.
You and I have both lived through the transition from paper
Paper
to
to
electronics.
Yes.
And so we're definitely reaching back into the paper world when we're asking for records for most of our patients.
Absolutely. And did you have another question, Alyssa?
Yes. Is there an upper age limit for patients to come to the survivorship transition clinic? Is it ever too late?
Not at all. The short answer is not at all. It's never too late. We see patients who arrive to us when they're 55 years old and they were treated when they were 17 and they've just learned about the patient or the accessibility of the clinic. And we do have a number of patients, as you alluded to earlier, who come directly either from Children's Mercy's Survivorship Clinic or from other providers here in the region or within our system. But we also have a number of self-referrals, patients who learn about the clinic from friends, loved ones, or the internet, and then reach out to us directly.
That's great. And I know that for those of you who are just joining us, we are talking today Facebook Live about our transitions clinic at the University of Kansas Cancer Center, which is focusing on adult survivors of childhood cancer. We have with us the medical director, Dr. Becky Lowry, and we're taking any last questions. I feel like our time has flown, and we have so much more we could talk about, but empowering really adult survivors. If you have a friend, a cousin, anyone who you interact with that might know someone who's an adult survivor of childhood cancer, I can't tell you how many anecdotal stories I've heard about your clinic. So I think that this is truly an amazing resource that I'm so glad when we are so lucky to have the clinic and your team here.
Well, thank you. Privilege to be a part of the process and be a part of our team here at the University of Kansas Health System. One of the things that we get asked a lot that might be helpful to tell people is, so when I come to the clinic, who am I going to see?
Yeah.
And they will see me as the physician. They will see Kyla as the nurse educator and nurse navigator. We also have a social worker in our clinic, and that's been an incredible resource for some patients who can help us with those elements. And we also have some support from a psychological standpoint with an embedded licensed counselor in our clinic. Over the last few months, we've been able to add that to our care team. So there's a lot of potential to provide some multidisciplinary support for patients.
Which is great, especially right now where I feel like our clinic visits are getting tighter and tighter. To have those resources embedded is really phenomenal.
Yeah. Absolutely.
Yeah, that's great. So there is a link at the bottom of your screen. Call us, check out the website, and please do refer friends, family, yourselves to this great resource, and Dr. Becky Lowry and Kyla, the navigator. And we hope that you will engage in your health. And like Dr. Lowry said, they come to you where you are as the patient, and I think that's a really unique way of dealing with healthcare. So any final thoughts that you have as we kind of sum up today?
I am really just excited to have the opportunity to visit more about the clinic, and we're really excited to just be here to help however it's necessary for patients and providers. And we often get calls when patients aren't sure either how best to connect with us or what the best process is, and we're happy to help individuals walk through that process as well.
That is great. So please, once again, use those resources. They're at the bottom of your screen. Thank you again to Dr. Lowry for joining us today. And next week, you're going to learn how to prevent skin cancer and recent advances in the treatment of melanoma. And it's right here on Wednesday at 10 a.m. So please join in, and thanks for joining the KU Cancer Center Facebook Live.